Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. BIMS Score Role in Identifying Dementia. BIMS stands for Brief Interview for Mental Status. The BIMS test is used to get a quick snapshot of how well you are functioning cognitively at the moment. A BIMS score can range from 0 to 15, with lower scores indicating a decline in cognitive performance. /r/n/r/n It is a required screening tool used in nursing homes and other long-term care facilities to assess cognition. Because the BIMS is given every quarter, the scores can help measure if you're improving, remaining the same, or declining in cognitive ability. /r/n/r/n This article explains how the BIMS test works. It covers how test results are scored and interpreted, along with how healthcare providers can use the results to tailor your care. /r/n/r/nVerywell, Laura Porterrnrn/r/n/r/n There are 3 sections in the BIMS assessment. /r/n/r/n The first section of the BIMS assesses immediate recall. The test administrator will speak 3 words, like sock, blue, and bed, which you will then repeat back. /r/n/r/n The second section of the BIMS assesses orientation. You will be asked to identify what month we are in currently, which year it is, and what day of the week it is. /r/n/r/n The third section of the BIMS assesses short-term memory. After the distracting task of orientation questions, you will be asked to recall the 3 words you had to repeat earlier. If you can't recall the words, you will be given a cue to help trigger the memory, such as something to wear to determine if that helps you to recall and say the word sock. /r/n/r/n The BIMS assessment uses a points system that ranges from 0 to 15 points. /r/n/r/n Test takers begin with 0 points and are awarded 1 point for each correct response they give. /r/n/r/n For the immediate recall test, 1 point is assigned for each of the 3 words repeated correctly for a maximum of 3 points. /r/n/r/n Example, the test administrator says the words sock, blue, and bed. When prompted to repeat them back, the test taker is only able to repeat the word bed. The test taker is given 1 point for this section. /r/n/r/n For the orientation test, between 1 and 3 points are assigned for each of the 3 sections for a maximum of 6 points. /r/n/r/n Identification of the year. /r/n/r/n Identification of the month. /r/n/r/n Identification of the day of the week. /r/n/r/n Example, the test taker is asked to speak the present year, month, and day of the week. They correctly identify the year and are awarded 3 points. The test taker incorrectly identifies the month and is awarded 1 point. They correctly identify the day of the week and are awarded 1 point. In total, the test taker gets 5 points for this section. /r/n/r/n The short-term memory test offers a maximum of 6 points. For this section, between 0 and 1 points are assigned for each of 3 RDS based on whether you /r/n/r/n Example, the test taker is asked to repeat the initial 3 words given in the immediate recall section. They can recall all 3 words, but only with cues. The test taker is awarded 3 points for this section, bringing their total BIMS score to 9 points. /r/n/r/n The BIMS is most often used as part of an assessment tool called the Minimum Data Set MDS, in nursing homes. The BIMS is conducted periodically to assess cognition over time. /r/n/r/n While the BIMS is not used to diagnose dementia, it can help identify changes in cognition over time. Significant deterioration of a BIMS score may trigger other, more comprehensive evaluations for dementia. /r/n/r/n The BIMS score can also help identify some basic needs of the person. For example, if you are unable to repeat the 3 words in the first section of the test, Perhaps you have a hearing impairment or you are unable to communicate verbally. /r/n/r/n alternately, if you are only able to remember the 3 words at the end of the test when the cues are provided, this can be a reminder to staff members that offering verbal or visual cues may be helpful in your activities of daily living. /r/n/r/n The BIMS assesses limited areas in cognition and thus it does not give a fully accurate picture of cognition. /r/n/r/n A person may appear to be higher functioning because the BIMS does not assess other areas of cognition such as executive functioning. /r/n/r/n However, research does indicate that it is a more reliable way to screen for cognitive functioning than simple observation. Other methods for predicting cognitive stages are also available. /r/n/r/n If you arraign a nursing home either for long-term care or for rehabilitation on a short-term basis, the BIMS will be administered, typically by a social worker. It is typically conducted on a quarterly basis but can be administered more frequently if significant changes are occurring in your condition. /r/n/r/n The value of the BIMS testing is that it can monitor for changes in cognition in a way that is fast and replicable. Because the responses are less open to interpretation, the results tend to be more consistent even if conducted by different testers. /r/n/r/n Moreover, it allows caregivers to know when it is time for more active intervention. A decline in score, for example, a 13 to a 9, demonstrates a notable change in mental abilities. A sudden decline in the BIMS score could help point out a condition such as delirium. /r/n/r/n Delirium sometimes develops from infections, including urinary tract infections and pneumonia. Prompt identification and treatment can often partially or fully restore cognitive functioning to its level prior to the delirium. /r/n/r/n The brief interview for mental status, BIMS, is an assessment used in nursing homes and other long-term care facilities to monitor cognition. The assessment involves 3 sections with the ultimate purpose of testing short-term word recall and orientation in time. T scores range from 0, suggesting severe cognitive impairment, to 15, suggesting intact cognition. The BIMS tests some areas of cognition, but not all. Nonetheless, it is a valuable tool for healthcare providers to identify and treat changes in mental abilities. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.